If I wanted to live another 5 years to see my grandchildren completely grow up or to see my children go gray, you look at those things and you look at your 15 grandchildren and you look at your children and you see and your husband, and there wasn't an option. If I wanted to be here, then I had to do something. I had to take that chance. About 20 years ago, my thyroid started shutting down, and when it did, I started putting on weight. And I never was a skinny person, but at that time, it really started coming on. Here came the diabetes, here came the blood pressure, the neuropathy, the arthritis. I have sleep apnea, I had sleep apnea, fatty liver, joint issues, lack of sleep. I was walking on a cane and walking on a walker. And my doctor had me come in and do some blood workup. So I came in and did some blood workup. And she said, Deborah, you're on double shots every day of insulin. You're on 3 pills in the morning, 2 pills at night for your diabetes alone. And I think it was a total of about 20 some odd medications I was having to take a day just to keep me level. And they couldn't level it anymore. The blood pressure was way up. The diabetes numbers in the morning were very high. And I was starting to suffer because of it. My body was showing distress over the diabetes. And she just told me flat out, she said, there's nothing more I can do. She said, you have no choice.
When she first came in, she had a lot of reservations, as a lot of patients do. Given her age and a lot of her medical problems, she wasn't sure if this was the right step to take. We sat down, we talked about it, we discussed her options, both surgical and non-surgical. After going through our bariatric program, she decided this was a step she wanted to take.
I like the fact that Dr. Dickerson, he doesn't try to mix words with you. He tells you what you're facing. He tells you what's going to happen. He tells you what your portion of responsibility is going to be. He tells you how the surgery is going to go and what you're facing when you have the surgery. But he also makes it perfectly clear that once you have that surgery, you're the one that has to make it work.
Deborah had a gastric bypass, and most of the bariatric surgery what we do is going to have some component of what we call restriction, where we make the gastric reservoir smaller. So in that case, we divide the stomach and make a little pouch and then reconnect the intestine to it. The other common operation that's done today is a sleeve gastrectomy, where we tend to remove 75 to 80% of the stomach, leaving a stomach that looks a lot like a banana. Both of those let you eat less, and a lot of what you eat is kind of bypassed in the case of a gastric bypass, and that's where the name comes from.
My blood pressure now reads 112/70. My sugar levels, where they were in the 250s to 350s in the morning, now they're in the 130s. I've lost 85 pounds. I still have another 60 to go. But my foreseeable future is to completely be off of blood pressure medication and off diabetic medication. The amount of medicine is just way down. I take like 8 pills versus 20 pills that I was taking earlier.
People who succeed are the ones that understand that surgery is not the magic pill. It's not that you have the surgery and then you lose the weight. After surgery, that's when the hard work begins. They have to watch what they eat, a proper diet. We only want them to take in about 1,000 calories per day. They have to stay away from any kind of fattening foods, sweets, or carbohydrates of that nature. They have to stay hydrated, but then they also have to exercise at least 5 to 6 times a week. And so patients who succeed, patients who understand the procedure, who investigate it, and are well informed and motivated, they're the ones that usually do very well.
I just want to say, I am now on 3 separate bariatric support group websites. And in those, everybody starts the same. Everybody, the very first question is, I'm getting surgery, I'm scared. What am I facing? Am I going to be able to eat this or eat that? When you go into this surgery, know full well you're not going in it to eventually get back into that ice cream and those chips and those cookies and the crackers. And believe me, you want to get back in those cookies and the crackers, I guarantee you. But this is your tool. It is what you use to correct the damage that you've done to yourself. And you've got to look at it as being, I don't want to go back. The grandkids are 100% behind myself. And my kids are always telling me, Mom, you're doing fantastic. You're doing great. My point is I did it. I made it through. And not everybody gets through it without complications. I did.
So here at St. Luke's Health, the Woodlands, we are a center of excellence in bariatric surgery. That's recognized by the American Society of Metabolic and Bariatric Surgeons. And as such, we provide a comprehensive weight loss program. We have both myself and Dr. Dickerson, my partner, are fellowship trained in minimally invasive surgery and bariatric surgery. We put an emphasis on the whole patient approach. We ensure that they get proper education. We ensure that they get all the resources and tools necessary. We have an extensive follow-up program where patients are basically ours for the rest of their lives as long as they're in this area and they want to come see us.